Thank you for tuning in with us in MedBay.
So hemostasis. Hemostasis is the formation of clot to prevent excessive bleeding. There are three main stages: the primary hemostasis, secondary hemostasis, and fibrinolysis, which is the breakdown of these clots. In this video, we're going to cover primary hemostasis in just under 3 minutes, which results in the soft initial clot, also known as the platelet plug. I have also briefly mentioned some disorders that may affect primary hemostasis. So in the blood vessels, the endothelium acts as a barrier between the luminal contents and the subendothelial structures, such as the smooth muscle cells, collagen fibers, and more. When the blood flows through these vessels, the larger and heavier blood cells and proteins flow more in the middle of the lumen. This is because the closer you are to the endothelium, the higher the resistance. So naturally, the smaller cells like platelets flow closer to the endothelium. Now, when there is an injury, the subendothelial layer is exposed. This means the smooth muscle cells, the collagen, they're all exposed. There is also vasoconstriction to prevent excessive bleeding. The von Willebrand factors stick to the exposed collagen and gets activated. Von Willebrand factor. They're usually produced by the endothelial cells and are secreted into the bloodstream in their inactive form. If you have von Willebrand factor disease, a genetic condition, you have deficiency of von Willebrand factor. This increases your chance of bleeding. So, the von Willebrand factors are activated, and now the platelets stick to the von Willebrand factors. This is known as platelet adhesion. Platelets. They're produced by the bone marrow, so you may get low platelets or thrombocytopenia, for instance, when there is bone marrow failure. Bone-Cellier's disease is an example of an inherited condition where there is fewer but larger platelets. One could also have thrombotic thrombocytopenia purpura. It is when excessive platelets adhesions leads with thrombocytopenia. So when there's another injury, because of the lack of platelets, this leads to bleeding. So back to platelet adhesion. When they adhere to von Willebrand factor, they become activated. And when they are activated, they do two main things. They change shape to get more projections, and they also secrete ADP and thromboxane. These secretions promote further platelet aggregation. At the end of primary hemostasis, you have a temporary soft platelet plug. To stabilize this clot, there is secondary hemostasis where a stronger fibrin clot is formed.
I hope you found that video useful. If you did, please leave a like and a comment and share with your friends. And to find out what happens in secondary hemostasis, how do we form the stable fibrin clot? Make sure you subscribe to this channel and hit the bell icon because we're releasing videos every Sunday. Thank you for tuning in with us in MedBay.